Hello, my name is Mary Drew, and I have lived in Jaffrey. It's where I've raised my 3 children for the last almost 5 decades. In March of 2008, I began, gratefully, my own recovery from alcoholism. And later that same year, I founded Reality Check to combat what I was seeing as an escalation in substance use in my community, but primarily in my kids' peer groups. And 10 months ago, I lost my younger brother, Peter, to complications of alcoholism. So my passion really remains strong for this work. Reality Check's mission is to reduce drug and alcohol use, abuse, addiction, and overdose, and the social and economic related costs to untreated addiction to individuals, to families, and to businesses within the 33 communities that make up the Monadnock Region. As you may or may not know, we are in a national drug epidemic, now within a pandemic, complicating matters. New Hampshire is actually 3rd worst in the country, with 500 almost last year, fatal drug overdoses. And locally, we had almost 450 police incidents related to drug and alcohol use. In 2016, we received a 5-year grant from the White House Office of National Drug Control Policy to implement prevention programming in 2 school districts. We have also provided, over the past 4 years, support to over 600 support group participants for people who have loved ones struggling with addiction or who have lost someone to overdose, to veterans, to grandparents who are raising grandchildren due to parental addiction, and to groups like 12-step groups like Alcoholics Anonymous. We've served around 900 students with programming, drug and alcohol prevention programming and curriculum. We also provide counseling treatment, medication-assisted treatment, recovery coaching, and strategies for employers to better support employees with substance use issues, as opposed to having policies that are zero tolerance. They can retain skilled workers. Specifically during COVID, we have offered Monadnock Community Hospital an on-call recovery coach program, allowing them to refer patients to our recovery coaches who may present with drug or alcohol use issues so they can gain immediate help. And this is at no cost to the hospital during COVID, and no cost to recipients or patients at any time. We're funded primarily by individual donations and local, state, and federal grants, which for the 2019-2020 year totaled almost $450,000. Since we don't charge individuals, schools, community members, or groups for our services, these funds are used primarily for programming and operational costs. Our services help reduce a lot of different peripheral services, like a reduction in the use of emergency and law enforcement services, healthcare costs for babies who are born addicted because there would be less of them, foster care placements, juvenile incarceration, mental health issues, and incidents of veteran and student suicide. Our goal is to help build resilient youth, resilient young adults, resilient families, to be empowered and hopefully someday, pay it forward in their own lives. In March of 2019, Reality Check was one of 5 grantees to receive funding to implement Governor Sununu's Recovery-Friendly Workplace Initiative, which expires September 30th. So if awarded, these funds would be used to expand employer services and strategies so they can better support employees who might be struggling, and the employee's family, if an employee has a family member who's struggling, so they can improve their overall health and businesses can get back to business. So from all of us at Reality Check and all the folks that we serve within the Monadnock region, I would like to thank you for your consideration. Great, thank you.